So you mentioned that you ran a clinical trial with, I think it was healthy older individuals. So actually, a couple of questions in there. So one is, what did you see? But kind of before that, uh, do you have older, basically older, healthy people coming into your clinic who want to be better? And what percentage of your customers would that be?
The percentage is us to define. So we have around in Israel, for example, we are treating around more than 300 clients per day. Okay, I cannot call them patients because if you are healthy or
Hmm.
at normal to your age, then you are not considered to be a patient.
Hmm.
Okay, you are according to your age. Of course, we all want to be much more than our age, and that's the beyond normal. Normal is really not relevant when you speak about you, about myself. We don't want to be the normal for our age. We want to perform to the better that we can, unless you below the normal. So that's us to define. So in Israel, that's the amount that we treat. In the affiliated Aviv clinic in Florida and Dubai, actually most of the patients are coming in reverse aging indication. Most of the patients have age-related functional decline. Even though if they be above normal, it's age-related functional decline as compared to themselves.
Mhm.
And today people just don't want that. We want to function. We want our brain to function. We want our cardiovascular function. We want our sexual function. We just want to function. We want to continue to enjoy to this world. And we don't take it for granted anymore that we're supposed to decline. Okay, we suppose a lot of stuff, but why not?
Mm.
Okay, why not to continue and enjoy the journey that we came to this world with? It's a beautiful journey, as long as you enjoy the view and feel the air on your face. If you are locked down in a closed environment, dark, you cannot communicate, that's a
Mm.
journey we don't want to be part of. So today, more and more people understand that they need to manage their health. Generally speaking, you have two options, is whether you are managing disease
Mhm.
or whether you are managing health. Managing disease, it's easy. You had a stroke, you need a treatment. You had a car accident, traumatic brain injury, you get a treatment, and then people are committed to do whatever they can. But managing health is not less important.
Mhm.
And if you are professional, you need to manage your health and you need to invest in your health. Invest the time and the resources in your health. That's how it is. If you will take, for example, professional Formula One driver, okay? They are in the race, every minute, every second count, but still they are making a stop at the pit stop.
Mhm.
Okay, they are losing time at the pit stop. No, they are not losing time because they know that if they will not do that, the tire will be damaged, they will have an accident, and the engine will collapse. So they are professional, so they are making a stop at the pit stop. And if we are professional to our body, at least to the level that we are professional to our car, we should have a pit stop. We should invest in our health before we have the collapse.
Mhm.
And that's the appropriate way to do it. And more people understand that and refer to themselves as professional, and they're doing the best to manage their health and be active about it.
Yes. So you did do a clinical trial, right, with these healthy older people. So, and you kind of referred to it a little bit before. Could you talk in a bit more detail about what you saw? Because I mean, it's like improved VO2 max and improved cognitive performance.
So what we have done we call it the reverse aging study. We have took individuals, healthy individuals, age 65 or older, No stroke, no diabetes, no significant cardiac problem, us fully functioning, non-obese, standard, active, enjoying life population. And we randomize them into two groups, the hyperbaric and the standard, the way they live. We haven't changed any other thing, just the hyperbaric. And before starting the protocol, we evaluate whatever we can. With regard to the brain, we did MRI, including DTI perfusion. We evaluate the cognitive function, memory, information processing speed, all of that. Cardiac function, cardiac MRI, cardiopulmonary exercise test, skin biopsy, senescent cell, telomere, everything can be evaluated before and after. And what we were able to demonstrate in that study is not that we are slowing the decline, slowing the expected cognitive declines, slowing the expected physical performance decline. What we were able to demonstrate is that we can actually improve it. We can actually take the biology back in time. And we can see that again in objective measure. If it's related to the brain, you see it in the perfusion and DTI MRI. You can see the improvement in the computerized cognitive test. You can see the improvement with cardiac MRI. You can see the improvement with cardiopulmonary exercise test. You can see the improvement with skin biopsies, with blood tests. You can actually see improvement, not slowing decline. And this is very exciting because in humans, not mice, not rats, even though we have also studies in those animal models, but in humans, we can actually see that we can take the biology and the functionality back in time. So that's the reverse aging program that we have and the reverse aging research that we done before.
Interesting. And that's a published paper. I can.
Yeah, you can read it. Yeah, there are several papers with regards to that. So people can just write my name, Efrati, and aging, and they will read the articles. Yeah.